The House Appropriations Subcommittee on Health and Human Services will come to order. Clerk, please take the roll.
Chair Morse.
Here.
Vice Chair Martis.
Here.
Representative Hood. Representative Braybeck.
Here.
Representative O'Neill. Representative Purry.
Here.
Representative Farhat.
Here.
Representative Price.
Here.
Representative Skaggs.
Here.
Representative Snyder.
Here.
Vice Chair Green. Representative Bolin. Representative Meerman. Representative Coombs. Here. Representative Steele. Madam Chair, you have a quorum.
Thank you, Clerk. Rep. Pori moves to approve the minutes of March 20 and April 10, 2024. Hearing no objection, the minutes are approved. Welcome, everyone, to a very exciting day, the moment you've all been waiting for, the House version of the 2025 proposed budget. We are very happy to be here in this moment. It's been many meetings, a lot of incredible hard work by everyone from House Fiscal, Dem Policy, my staff, and all the members of this committee. We are very much looking forward to offering this today and watching it as it progresses through the process. So first, we have to move to adopt the H1 substitute for House Bill 5556. Rep. Skaggs moves that substitute. Clerk, please take the vote.
The question for the subcommittee is the adoption of the H1 substitute for House Bill 5556. Chair Morse.
Yes.
Vice Chair Martis.
Yes.
Representative Hood.
Yes.
Representative Braybeck.
Yes.
Representative O'Neill.
Yes.
Representative Purry. Representative Farhat.
Yes.
Representative Price.
Yes.
Representative Skaggs.
Yes.
Representative Snyder.
Yes.
Vice Chair Green.
Yes.
Representative Bolin.
Yes.
Representative Meerman. Representative Kuhn.
Yes.
Representative Steele.
Yes.
Madam Chair, the amendment is adopted.
Thank you, Clerk. So the first order of business is that we invite House Fiscal to present a summary of House Bill 5556 H1. Sydney Brown will be presenting. Go ahead, Sydney.
Good morning, Madam Chair and members of the committee. Sydney Brown from House Fiscal. I will be reporting on House Bill 5556 H1, which is the fiscal year 2024-25 House recommendation for the Department of Health and Human Services. I will be reading off the document that is the summary and analysis. You all have it in front of you. I will say it's 17 pages. So in the interest of time, I'm just going to touch on items where the House proposal differs from the executive. Starting with the table at the top, the House proposal for the fiscal year 2024-25 budget is $37.8 billion gross, $6.8 billion general fund. This is an increase from the year-to-date of $2 billion gross and $304 million general fund. So if you also wanted to compare that to the executive recommendation, the House bill represents a $61.2 million gross or 0.2% increase from the executive recommendation and a $62.7 million general fund or 0.9% increase. So I'm going to have us turn to page 2 to start. Item number 8, the MyHIN maintenance. The House includes $3.2 million general fund to provide additional system maintenance funding for the Michigan Health Information Network, also known as MyHIN. I'm going to be jumping a lot, so sorry if it confuses anybody. We're going to jump to page 3. Yes. Item 13, we're in the community services space now. Items 13 and 15 together is $5.3 million general fund and one-time items for housing and shelter supports. Item 14, pre-weatherization services, one-time. The executive included $5 million to draw down federal IJA funds. The House includes that $5 million as pre-weatherization services. Jumping to child welfare, item 17, the child caring institution rate restructure. The executive included $38 million gross, $30 million general fund to restructure contracts to private residential child placing agencies. The House included $25.4 million gross, $20.3 million general fund. This funds 600 residential beds, a 9% increase to the current per diem rates to support employee retention and recruitment, and a rate for unfilled residential beds that is 90% of the filled bed rate. This amount also does not include the executive's proposal for an additional 6 FTEs in this space. Moving to page 4, item 20, Family Preservation Program increase. The House includes $12.2 million TANF to support community-based family preservation and prevention programming to keep children in their homes and out of foster care. Moving to item 21, foster care administrative rate increase. The House includes $11.8 million gross, $5.5 million general fund to provide a $5 increase to the administrative rate for private foster care agencies. The increase would increase the rate from 55/20 to 60/20. Jumping to item 23, juvenile justice investments. The executive includes $11.9 million gross, $10.7 million general fund, and authorizes an additional 21 FTE positions to implement recommendations for the governor's task force on juvenile justice. That amount also includes $5 million one-time for capital improvements to the 2 residential facilities, Shawano and Bay Pines. The House concurs but does not include the $5 million one-time. Jumping to item 25, the MISEP strategy and improvements. The executive includes $10 million general fund to provide programming and staffing supports in order to meet identified MISEP benchmarks. The House does not include. Moving to page 5, item 30, the Children's Services Administration training is one time. The executive includes $2 million. The House concurs. And item 31, the Juvenile Justice Deferred Maintenance, which is also one time. The House includes $1 million general fund to Spectrum Human Services for renovations and security upgrades needed to reopen a secure residential juvenile justice facility. So about $3 million one time in the child welfare space. Moving to public assistance, item 33, the executive proposal was for $100 million TANF to support a new program and supplement various other public assistance programs. The House concurs, includes $78 million gross, $11.6 million general fund, and adjusts the appropriation to include $28.4 million TANF to increase FIP payment standard by 25%, $30 million gross, $11.6 million general fund for local office emergency relief grants. This is a 30% general fund increase for cases without children. $9.6 million TANF to create an ongoing prenatal and infant support program, and $10 million TANF to increase the FIP Young Child Supplement amount to $150. Moving to item 34, Michigan Energy Assistance Program, MEAP. The executive includes $15 million general fund to increase the pool for state emergency relief grants. The House includes $7.5 million general fund. I would like to note that this is the first time that general fund is included in this line. Item 35, employment and training support. This is a one-time item. The executive included $5 million general fund to increase the grant pool for employment and support services. The House includes $2.5 million general fund. Page 6, item 36, water affordability. This is a one-time item. The House includes $10 million general fund for efforts including paying water arrearages, shut-off notices, and subsidizing other water affordability programs. Item 38, double up food bucks. House includes $3 million general fund to increase EBT capabilities for grocers and farmers markets to accept the Michigan Bridge Cards and apply double up food bucks credits. Moving into behavioral health, item 39, certified community behavioral health clinics, also known as CCBHCs. The executive included $193.3 million gross, with a net increase of $35.6 million general fund, and authorized an additional 12 FTE position to expand CCBHCs to additional counties. The House includes $153.2 million gross, $27.7 million general fund to expand CCBHCs to an estimated 40,000 additional individuals. Section 1002 was also revised to require that expansion funds are prioritized to counties that did not originally have a CCBHC. Item 40, autism services. House includes $12.5 million gross, $4.4 million general fund to increase the autism behavioral technician hourly rates from $53.20 to $62 per hour. Jumping down to item 43, opioid healing and recovery fund. The House adds $53.4 million of state-restricted opioid healing and recovery fund to provide grants to 7 different groupings, including PIHPs, non-Medicaid, hospital peer recovery coach services, and tribal entities. There's also 3 other one-time projects listed there at the bottom. They're the Great Lakes Recovery Women's Recovery Center, Recovery Community Organizations, and Andy's Place for SUD services. Page 7, we'll be really quick with this one. Items 44 through 48 are new House items that would provide $4.7 million general fund to the 5 listed programs. Page 8, item 55. Those are one-time behavioral health services funding, so $24.1 million general fund will be used to fund the 10 programs listed below. Moving into public health, item 56, racial disparity task force initiatives. The executive continues $45 million gross, $20 million general fund to support community-based health clinics, mobile health units, healthy community zones, and includes $25 million in federal state fiscal recovery funds. The House includes $2.5 million to support the mobile health units, and $2.5 million general fund is also allocated on a one-time basis for the Sickle Cell Center for Excellence. The number you see over on the right-hand column is the back out of the $36 million of one-time included with the $5 million for those 2 programs that I just mentioned. Item 57, smoking prevention and cessation increase. The executive included $5 million general fund to expand tobacco cessation and prevention programming. The House includes $2.5 million of Healthy Michigan Fund revenue, which is the tobacco tax. Jumping down to item 61, family planning and local agreements. This is a one-time item. The executive includes $14.2 million general fund to support statewide family planning services. The House does not include. I will note that this item is in the budget on an ongoing basis. The appropriation for fiscal year 23-24 is $15.8 million gross, $7.3 million general fund. Page 9, item 62. The nursing loan repayment program. This is a one-time item. The executive included $10 million to provide student loan repayment for eligible nurses employed by public and private health facilities in the state. The House includes $2.5 million general fund for this program. Item 63, perinatal quality collaboratives increase. The executive continued $5 million general fund in the one-time space for perinatal quality collaboratives. The House moves this item to ongoing and includes that as $5 million general fund. Item 64, community violence prevention community grant program. This is also just called CVI. The executive includes $5 million in state fiscal recovery fund revenue to expand the violence prevention programming. They also included $500,000 ongoing general fund to support the CVI office. The House concurs with that amount of funding and moves the $5 million from one time to the ongoing space, and it concurs with $500,000 to support the central CVI office. Items number 65 and 66 are firearm injury and firearm safety programming. Together, it is $9.3 million of general fund, with item 65 being allocated to the University of Michigan and item 66 being allocated as grants to community organizations. Item 67 is firefighter healthcare. This is a one-time item. The executive includes $3.5 million general fund to provide health screenings for firefighters. The House does not include this. Item 68, nursing workforce initiative. This is also a one-time item. The House includes $10 million to Wayne State University to support efforts to reduce nurse turnover and improve retention. I will do item 69, and on the next page, item 70 together. So this is 15.4 million general fund for public health-related one-time items, which, as you can see with item 69, includes domestic violence and sexual assault services. Moving into aging services, item 72, long-term care ombudsman program. The House adds $3 million general fund to the long-term care ombudsman program to investigate resident concerns, respond to involuntary discharges, and provide trainings on long-term care topics. Moving into health services, item 75, federally qualified health centers, scope change, also known as FQHCs. House includes $40 million gross, $11.3 million general fund for cost estimates related to Medicaid scope change expansion for the FQHCs. Moving onto page 11, item 78, the Medicaid health plan procurement reforms. The executive included $20 million gross, $7.6 million general fund, and authorized an additional 14 FTE positions to implement a new Medicaid health plan procurement program. It's also called My Healthy Life. The House concurs, but does not include administrative costs in the 14 FTE positions. So that third bullet point, $3 million gross, $1.6 million general fund, is not included in the House budget. Moving down to item 81, Medicaid doula care. The executive includes $4.9 million gross, $2 million general fund to increase Medicaid reimbursement rates to doula services, increase number of doula care visits from 6 to 12, and provide educational and training services. The House concurs and increases the ongoing funding to $7.1 million gross, $2.6 million general fund. That amount includes $2.9 million gross, $1.5 million general fund on a one-time basis. Item 82, centering pregnancy. The executive continues $2.5 million general fund on a one-time basis for the centering pregnancy program. The House moves that item to the ongoing space and keeps it at $2.5 million. Moving to page 12, item 86, MyDocs enhancement. The House includes $9.2 million gross, $4.6 million general fund to increase grant base to support medical doctors through tuition loan relief for services provided in underserved and impoverished communities in the state. Item 88, private duty nursing rate increase. House includes $8.1 million gross, $2.8 million general fund to increase Medicaid reimbursement rates for private duty nursing services by 25%. Jumping all the way down to item 94, one-time health services funding. The House includes $8.8 million general fund for health services related one-time items that are summarized in the bullet points below. And that includes part 1 funding. We're going to go quickly through boilerplate. I promise we don't have much more. Page 13, sections 298 and 299. The executive revised these sections to specifically revise the receive and expend authority. The House does not include these revisions. Page 14, We're going to the Children's Services Agency, Child Welfare and Juvenile Justice space. I'll talk about sections 503, 504, and 512 quickly. Section 503 has to do with funding for the West Michigan Partnership for Children, as does section 504. With section 503, the executive proposed to delete, the House retains current law. With section 504, the executive revises by replacing current year language with new language requiring DHHS to complete an examination of the effectiveness of the contract with the West Michigan Partnership for Children. The House retains current year language and moves that executive language to section 512, and also adds a report that requires the department to report the results of that examination to the legislature. Section 510, alternative payment methods, was revised. This was revised for the child caring institutions contract restructure. The executive deleted subsection 1 and revised subsection 2 to make the report quarterly instead of monthly. The House revised subsection 1 to include language on requirement that the new CCI contracts are for 600 beds, the 9% increase to the current rates, the 90% unoccupied bed rate. And subsection 2 prohibits DHHS from proposing certain requirements in their contracts with providers. And subsection 3 retains current law report language, so it will continue to be a monthly report. Section 595, the MISAP strategies and improvements. The executive required the department identify necessary investments in new programs and supports for children in care in order to exit the settlement agreement. The House does not include. Page 15, section 960, autism services provision and cost containment. This was revised. The executive deleted this, and the House revised by removing specific listing of qualified licensed practitioners and for master's level evaluations to be reviewed by another practitioner. Section 1158 on page 16 in the public health space, the Crime Victims' Rights Sustaining Grants. The House revised this by changing the allocation amount to $29.9 million to reflect the striking of section 1162 for the trauma recovery pilots, which added $4 million back into the Crime Victims' Rights Sustaining Grants line. And if anyone's curious, the remaining funding is for the Sexual Assault Nurse Examiners Program, which is $102,600. Moving down to section 1325, local perinatal quality collaboratives. The House retained the current law language and includes an additional $5 million general fund, which I did touch on in the part 1. Moving to the final page, page 17, section 1854, PACE enrollment cap. The House revises to increase the enrollment cap from 7,553 to 8,543 to reflect additional funding introduced in Part 1. And with that, my colleagues and I are available to answer any questions.
Thank you, Sydney, so much for that presentation. And as everyone in this room knows how critical House fiscal analysts are to this work, we obviously could not do it without them, and we are so grateful for their breadth of knowledge that they bring and just help us really create the best budget that we can. So I just want to take some time to highlight some of the appropriations that we proposed and why we've done it. First of all, in the area of behavioral health, we know that as a state, we are still struggling to provide the resources that people need to have a healthy life. So was happy to continue the expansion of CCBHCs, as well as increase the reimbursement rate for our providers. Having enough providers in the state is something that we are constantly trying to address, and that is a way that we can encourage people to, when they study here, to stay here. Autism services, we know that the rates of autism are increasing, and our CMHs and the service and the companies that provide the service are having trouble keeping up with all the demand, and so we are ensuring that the workers that we have here are going to stay here in Michigan and provide that much-needed work. We also, in the child welfare area, which again is probably the hugest responsibility that the state budget has to our children who are most in need. And so we thought it was really important to address as many areas as we could in this budget, including the child caring institution rate restructure. And that's going to also ensure that we have 600 beds that are kept available so that we can lower those wait lists. It's not always easy to do because the beds that we need are not always the beds that we have available, but this will give us more room to ensure that we're placing kids properly and getting them the services they need. The Family Preservation Program increase, again, is critical. Our state has the goal of keeping families together. It is a way to reduce trauma for children. And the sad fact about removal is the number one reason is poverty. And that is not helpful to the children or the families. So I look forward to what we can do through programming like that ensures families get the resources they need so that their kids can stay with their family. The foster care administrative rate increase, however, is needed as well because so many kids are pulled out and need to have safe spaces. And the acuity levels are high, as we hear across the board. So we know that our foster care administrators in the private space need as much help as they can get. Court-appointed special advocates, that's something near and dear to me. And I understand how much our kids need someone on their side to make sure they're getting the best results when they're in the court system. Foster care disability navigators for those kids who've been in foster care and need help with getting through school and accessing all the resources they need. And going back to the poverty piece, and when we talk about social determinants of health, there are many pieces in this budget that address that, including the increases to the FIT payment by 25% and extending eligibility to 60 months. As well as that $30 million is a quite significant investment for local emergency relief grants, which can help people who have issues with bills or food supports or whatever else they need. We're also increasing the Young Child Supplement, which they will get $150 for each child monthly. We have the Double Up Food Bucks, which, again, food supports is huge. We did a big investment last year, but we know that investing in Double Up Food Bucks ensures that children and families get all the fresh produce that they need and the healthy food to have a healthy life. So I'm very excited to include that, as well as the investments in pre-weatherization. So this state has a lot of federal dollars available for weatherization, but the sad fact is only 1 in 4 homes that is assessed for weatherization is eligible based on the pre-weatherization needs that they have. So moving more money to the pre-weatherization side to ensure that those homes are ready for that weatherization and then in turn are more energy efficient and their bills are reduced helps close the circle on what we're trying to do there. Water affordability is something that a lot of people came to us regarding. We had the extra $60 million last year. We don't have that kind of money this year, but we respect that it's a need, and so we did put $10 million there. For our aging population, another at-risk population, we respected the need for expansion of the ombudsman availability. We also did the PACE expansion, which, and the My Choice family structure, the family supports, so that they again, are surrounded with all the supports they need to be able to stay in their homes and be safe. In terms of community violence, I'm sure many people in this room know that that is something important to me. It's the number 2 cause of death for children in the state. It's the number 1 cause in the country. And it's preventable. And so it is on us to do everything we can to prevent gun violence, and we are putting our money where our mouths are, and making sure that we can put programming in place that will reduce community violence overall and train and educate people on the new firearm laws that we passed last year. Domestic violence, sexual assault, and child advocacy centers is another critical piece. The federal funding from the Victims of Crime Act has been reducing over the years. We continue to try to backfill that to ensure that services do not need to be reduced for, again, very vulnerable people facing very difficult situations. In terms of other public health funding, happy to invest in, dental programs, which are so important, and other programming in the sexual assault space as well. You all know that maternal infant health and the disparity there, especially in terms of race, is something that the state has been working very hard to address and to try to figure it out. So continued investments in the maternal infant space, you will see sprinkled throughout this budget, and we're going to continue doing what we can to try to improve our statistics on maternal infant mortality and specifically in racial disparity, which sadly, where the overall infant mortality rate is improving, our racial disparity is not. So we need to continue to do the work there to figure that piece out. Also proud to include money that would cover the waiver for Medicaid coverage for incarcerated individuals. This is $30.5 million gross to provide Medicaid to incarcerated individuals 90 days prior to their reentry, and that again gives them an opportunity to have their health care. One piece of what they can do to get out back into the world and have the opportunities that will afford them a new life after they've served their time. Let's see, what else? You will see a significant additional spending in the opioid space. So the department does have their spending plan for '24 that we've seen, but that leaves $100 million on the table, and I think it's important that we start moving those dollars out in a manner that is efficient and takes advantage of the resources that already exist. So we are proposing to move $30 million through the PIHPs, who are already the organizations that do substance use disorder work in the state, as well as some one-time spends that will get some housing going and recovery peer coaches who are so critical to the continuum of care with substance use disorder. I'd also note that we are taking $5 million to move to tribal communities because they are overly impacted proportionally by opioid use and other addiction, and we want to make sure that they are taken care of with those opioid dollars. Oh, I need to take a breath. We have, I did skip over the one-times in behavioral health services, so those again are investments into resources that you will see sort of sprinkled across the state, including for the My Michigan Medical Center in the Sioux for behavioral health beds that are so needed in the northern part of the state. $1.7 million for Common Ground, which is the organization that has been responding to the mass gun violence incidents in the state, and also money going towards suicide prevention efforts. So overall, I think this budget really is a people-first budget. We tried very hard to look at the needs that many people came to talk to us about and to address them the best way we can with the resources that were available or are hopefully available for 2025. And trying to make sure that every piece that is a part of health and human services, whether it's child welfare, juvenile justice, behavioral health, or others, that they all see a piece of what we have to improve programming and availability, that people have access to health care. It is a critical piece of success for our state and making sure everyone has the resources they need for quality of life. And with that, I will open it up to any questions. Representative Steele. Oh, I'm so sorry. I accidentally hit the mute
You
button.
did turn me off.
It was not purposeful, I swear. I swear.
I don't blame you, but thank you. So thank you for your work, and thanks Cindy. I really appreciate fiscal agency for all the time that they put into this budget. It is a big budget. It's half the budget for the whole state, close to $37 billion with a $2 billion increase. And unfortunately, we were only given 18 hours to review it. So my question might be easy for some, but maybe you can just enlighten me a little bit. I'm really questioning just the housing. 12 through 15 on page 3, also with the water affordability and the weatherization. It seems that there might be some redundancy with the housing in other budgets, and I don't know if that was looked into at all, like maybe in the Leo budget and stuff. And I'm just concerned about the sustainability of this budget. It keeps on going upwards, and I just moving into the next couple years, want to make sure these programs are sustainable. And so maybe the housing in this budget might need to be removed and put into other budgets. So it's actually a question and a comment, is if that was looked at in other budgets of the housing section of this.
I would say that I did not have a discussion with Chair Snyder about what housing is included in his budget, but these are specific asks regarding housing for specific health and human related issues. Substance use disorder, victims of sexual violence. It's specific housing to help people in those areas. But thank you for your comment. Rep. Farhat.
Thank you, Chair Morse. I want to first congratulate you on a second budget, or soon to congratulate you on a second budget. And, I want to thank you for the intentionality that you've shown both in keeping people in their homes, right, and keeping families together. Two very important themes that I'm glad we're building on from previous year's budget and seeing certain programs expanded and invested in. For me, it's pre-weatherization was an important ask. I think for a lot of folks, when you look at weatherization programs, they're great to help keep people in their homes, make it more affordable, modernize their homes. But when you knock on somebody's door, most times like we do here, you'll see that they have a roof that's covered with a blue tarp. They have lead in their home. They have things that make it unsafe to weatherize. And so I want to thank your leadership on this budget. I want to thank your willingness here to continue to expand on the theme of keeping families together and keeping people in their homes, keeping services where they are. I think it's remarkable what we've managed to do, and I want to thank you for that, Chair. I really do. I know it's this year, again, it's the last budget you'll do for us in this chamber, and so thank you for your leadership there. Thank you.
Rep. Price.
Thank you for this budget. I'm very proud that our budget is addressing gun violence for the public health crisis that it is. And I wanted to hear a little bit more about items 64, 65, and 66 on page 9. Your commitment to do ongoing funds in this space and to do some additional funds, not only to that great program at University of Michigan, but to community-based organizations as well. Could you talk a little bit about the needs and how we're helping to meet them?
Absolutely. So last year, you'll recall that the $5 million was one time. It was very important to me to move it into the ongoing to signal that this is not a one-time thing. We have, to have an intentionality about the investment in community violence intervention, and that we are committed to continuing to invest in it until we make a significant reduction in it. And so that's why I wanted to put the money in ongoing. Even though the budget is done every year, it signals to everyone that this is what we intend to keep investing in this. The money for communities directly, community-based orgs for training and programming, they're often best suited to connect to the members of their community to translate that information, and they have trusted community members, which is critical in this space. We heard it over and over again, and so we wanted to make sure that some dollars are going down to those community orgs so that they can help be messengers that their community will trust. Okay, we are going. All right, we're going to turn to amendments. So we have a number of amendments that are being offered today. And first, we will start with Rep. Steele.
Thank you, Madam Chair. Mine has to do with, I'm sure the committee is aware of the Shawano facility in Grayling, which was recently hit with several MIOSHA complaints. And this amendment would require that the department provide this committee with a report on the outcome of that complaint so that we are aware of whether the complaint was justified or not. And if we need to look further into these facilities to ensure that they have the resources that they need and are operating in a way that protects both the children within them and the staff who works there. So the amendment is on page 98, line 2, and so I move my amendment.
Thank you, Rep. Steele. Any discussion? Clerk, please take the vote.
The question before the subcommittee is the adoption of the Steele Amendment titled Amendment 1. Chair Morse.
Pass.
Vice Chair Martis. Pass. Representative Hood. Pass. Representative Braybeck. Representative O'Neill. Pass. Representative Puri. Pass. Representative Farhat. Pass. Representative Price. Pass. Representative Skaggs. Pass. Representative Snyder.
No.
Vice Chair Green.
Yes.
Representative Bolin.
Yes.
Representative Meerman.
Yes.
Representative Kuhn.
Yes.
Representative Steele.
Yes.
Madam Chair, the amendment does not pass.
Thank you, Clerk. Rep. Bolin.
Thank you, Madam Chair. This amendment would merely restore the remove reports in Section 964, Standardized Fee Schedule, Section 1775, My Health Link, and Section 1903. And with that, I move my amendment.
Thank you, Rep. Bolin. Any discussion? Seeing none, please, Clerk, please take the vote.
The question for the subcommittee is the adoption of the Bolin Amendment titled Amendment Number 2. Chair Morse.
No.
Vice Chair Martis.
No.
Representative Hood. No. Representative Braybeck. Representative O'Neill. No. Representative Puri. Representative Farhat.
No.
Representative Price.
No.
Representative Skaggs.
No.
Representative Snyder.
No.
Vice Chair Green.
Yes.
Representative Bolin.
Yes.
Representative Meerman.
Yes.
Representative Kuhn.
Yes.
Representative Steele.
Yes.
Madam Chair, the amendment does not pass.
Thank you, Clerk. Next, we have Rep. Steele.
Thank you. It's regarding the Opioid Advisory Commission, and this amendment would require that the department work with the Opioid Advisory Commission to align the remaining funds that are not already dedicated in the committee proposal today that we have just seen, with recommendations of this commission. The commission has already been set up with experts that are in the field, and I would like to rely on their recommendations and to utilize these funds that are left on the table to be able to have their knowledge and this department to utilize the resources that we've already set up in this capacity. So it's amending page 111, line 14, and I move my amendment.
Thank you, Rep. Steele. Any discussion? Seeing none, Clerk, please take the vote.
The question for the subcommittee is the adoption of the Steele Amendment titled Amendment Number 3. Chair Morse.
No.
Vice Chair Martis.
No.
Representative Hood.
No.
Representative Braybeck. Representative O'Neill.
No.
Representative Puri.
No.
Representative Farhat.
No.
Representative Price.
No.
Representative Skaggs.
No.
Representative Snyder.
No.
Vice Chair Green.
Yes.
Representative Bolin.
Yes.
Representative Meerman.
Yes.
Representative Kuhn.
Yes.
Representative Steele.
Yes.
Madam Chair, the amendment is not adopted.
Thank you, Clerk. Our fourth amendment is Rep. Bolin.
Thank you again, Madam Chair. This amendment would remove the new $5 million for employment training and supports. It does seem somewhat duplicative of our emergency supports programs through our local offices. And with that, I would move my amendment.
Clerk, please take, I'm sorry, any discussion? Seeing none, clerk, please take the vote.
Question for the subcommittee is the adoption of the Bolin Amendment, titled Amendment Number 4. Chair Morse.
No.
Vice Chair Martis.
No.
Representative Hood. No. Representative Brayback. Representative O'Neill. Representative Purry. Representative Farhat.
No.
Representative Price.
No.
Representative Skaggs.
No.
Representative Snyder.
No.
Vice Chair Green.
Yes.
Representative Bolin.
Yes.
Representative Meerman.
Yes.
Representative Kuhn.
Yes.
Representative Steele.
Yes.
Madam Chair, the amendment is not adopted.
Thank you, clerk. Next proposed amendment, Rep. Kuhn.
Yeah, thank you, Madam Chair. I'd like to move an amendment to increase the one-time funding for families against narcotics to $7 million. I move that amendment. Thank you.
Thank you, Rep. Kuhn. Is there any discussion? Seeing none, clerk, please take the vote.
The question for the subcommittee is the adoption of the Kuhn Amendment, titled Amendment Number 5. Chair Morse.
No.
Vice Chair Martis.
No.
Representative Hood. No. Representative Brayback. No. Representative O'Neill. No. Representative Purry. No. Representative Farhat.
No.
Representative Price.
No.
Representative Skaggs.
No.
Representative Snyder.
No.
Vice Chair Green.
Yes.
Representative Bolin.
Yes.
Representative Meerman.
Yes.
Representative Kuhn.
Yes.
Representative Steele.
Yes.
Madam Chair, the amendment is not adopted.
Thank you, clerk. Next, we have Rep. Green.
Thank you, Madam Chair, and it has been a pleasure working with you on this budget. We know that educational attainment is a clear determinant of future success. A student that graduates from high school has a much better chance of future success than one who drops out. My amendment requires parents to have a vested interest in their child's educational achievement. Thus, my amendment reinserts the language that tells us that the department is enforcing the truancy policy and whether the truancy issue is improving or declining. We in the legislature need to have the accurate information so we can address this issue. Madam Chair, I move my amendment.
Thank you, Minority Vice Chair Green. Is there any discussion? Seeing none, clerk, please take the vote.
The question for the subcommittee is the adoption of the Green Amendment, titled Amendment Number 6. Chair Morse.
Pass.
Vice Chair Martis.
Pass.
Representative Hood. Representative Brayback. Representative O'Neill. Representative Purry. Representative Farhat.
Pass.
Representative Price.
Pass.
Representative Skaggs.
No.
Representative Snyder.
No.
Vice Chair Green.
Yes.
Representative Bolin.
Yes.
Representative Meerman.
Yes.
Representative Kuhn.
Yes.
Representative Steele.
Yes.
Madam Chair, the amendment is not adopted.
Thank you, clerk. Next, we have Rep. Meerman.
Thank you, Madam Chair. There are 1.3 million emergency room visits and 350,000 hospitalizations a year caused by medication adverse effects. I'm offering an amendment to fund a pilot program to study and identify prescription drugs that lead to these emergency room visits. With that, I move my amendment.
Thank you, Rep. Meerman. Any discussion? Seeing none, clerk, please take the vote.
The question for the subcommittee is the adoption of the Meerman Amendment, titled Amendment Number 7. Chair Morse.
No.
Vice Chair Martis.
No.
Representative Hood.
No.
Representative Brayback. Representative O'Neill. Representative Purry. Representative Farhat.
No.
Representative Price.
No.
Representative Skaggs.
No.
Representative Snyder.
Pass.
Vice Chair Green.
Yes.
Representative Bolin.
Yes.
Representative Meerman.
Yes.
Representative Kuhn.
Yes.
Representative Steele.
Yes.
Madam Chair, the amendment is not adopted.
Thank you, clerk. Rep. Meerman with our 8th amendment.
Thank you again, Madam Chair. I'm offering an amendment suggesting asking for a family finding pilot program in Muskegon County. This initiative has been proposed by the Child Welfare Improvement Task Force, a body created within the DHHS to identify policies and practices to alleviate stresses on our foster care system. I think this could go a long ways towards helping keep families and kids within their nuclear families. I move my amendment, Madam Chair.
Thank you, Rep. Meerman. Any discussion? Seeing none, clerk, please take the vote.
Question for the subcommittee is the adoption of the Mearman Amendment titled Amendment Number 8. Chair Morse.
No.
Vice Chair Martis.
No.
Representative Hood. No. Representative Brayback. Representative O'Neill. No. Representative Curry. Representative Farhat.
No.
Representative Price.
No.
Representative Skaggs.
Pass.
Representative Snyder.
Yes.
Vice Chair Green.
Yes.
Representative Bolin.
Yes.
Representative Mearman.
Yes.
Representative Kuhn.
Yes.
Representative Steele.
Yes.
Madam Chair, the amendment is not adopted.
Thank you, Clerk. And with our final amendment, Rep. Mearman.
Thank you, Madam Chair. This amendment asks for Kinship Advisory Council enhancement. Again, this is along the lines of working to keep kids within their family structure. I move this amendment.
Thank you, Rep. Mearman. Any discussion? Seeing no further discussion, Clerk, please take the vote.
The question for the subcommittee is the adoption of the Mearman Amendment titled Amendment Number 9. Chair Morse.
No.
Vice Chair Martis.
No.
Representative Hood. No. Representative Brayback. Representative O'Neill.
No.
Representative Curry. Representative Farhat.
No.
Representative Price.
No.
Representative Skaggs.
No.
Representative Snyder.
Pass.
Vice Chair Green.
Yes.
Representative Bolin.
Yes.
Representative Mearman.
Yes.
Representative Kuhn.
Yes.
Representative Steele.
Yes.
Is that a yes or pass?
Yes.
Yes. Madam Chair, the amendment is not adopted.
Thank you, Clerk. Vice Chair Bardis moves to report House Bill 5556, substitute H1 to the House Standing Committee on Appropriations with recommendation that it pass. Clerk, please take the vote.
The question for the subcommittee is the adoption of House Bill 5556, substitute H1, report to the Appropriations Committee with recommendation that it pass. Chair Morse.
Yes.
Vice Chair Martis.
Yes.
Representative Hood.
Yes.
Representative Brayback. Representative O'Neill.
Yes.
Representative Curry.
Yes.
Representative Farhat.
Yes.
Representative Price.
Yes.
Representative Skaggs.
Yes.
Representative Snyder.
Yes.
Vice Chair Green.
Pass.
Representative Bolin.
Yes.
Representative Mearman.
No.
Representative Kuhn.
No.
Representative Steele. Madam Chair, House Bill 5556, substitute H1 is reported with recommendation.
Thank you so much, Clerk. Thanks again to everyone who participated in the making of this incredible budget, especially House Fiscal, Dem Policy, my staff, the members of the committee, and the members of the public who asked to meet with us and who came to testify. It was all critical to putting this all together. Thank you so much. Seeing no further business, this meeting is adjourned.